The medical field stands as a cornerstone of societal well-being, offering an expansive array of specialties. Each discipline presents unique intellectual challenges, demanding skill sets, and profound professional rewards. From primary care to highly specialized surgical interventions, the breadth of practice is immense. Within this diverse landscape, career choices are influenced by numerous factors. These include personal passion, intellectual curiosity, lifestyle preferences, and the desire for impactful patient care. Financial considerations, while not always the primary driver, undeniably play a significant role in long-term career planning and satisfaction. This analysis aims to provide a data-driven overview of the medical specialties consistently ranking among the highest in terms of compensation. Our focus extends beyond merely listing these fields. We delve into the underlying factors that contribute to their lucrative earning potential. Understanding these drivers is crucial for medical students and healthcare professionals. It offers valuable insights for career guidance, salary research, and job comparison. This information is meticulously compiled from recent industry reports, compensation surveys, and established market trends within the healthcare sector. The objective is to present a professional and analytical perspective on medical compensation. This approach helps in attracting talent to critical areas of medicine. It also provides a clear, evidence-based foundation for understanding the economic dynamics of specialized medical practice. Neurosurgery consistently ranks at the pinnacle of medical compensation across various global healthcare systems. This specialty commands the highest average salaries, a trend that has remained stable over many years. The financial remuneration reflects the extraordinary demands and critical nature of the work. The exceptionally high salaries in neurosurgery are directly attributable to the highly specialized nature of the work. Neurosurgeons operate on the most intricate and vital systems of the human body. Their expertise is unparalleled in addressing conditions affecting the brain, spine, and peripheral nervous system. The scope of neurosurgical practice encompasses a vast array of complex procedures. These include delicate brain tumor resections, intricate spinal cord repairs, and interventions for cerebrovascular diseases. Each operation demands meticulous precision and an in-depth understanding of neuroanatomy and physiology. Becoming a neurosurgeon requires an extensive and rigorous training pathway. This typically involves 4 years of medical school, followed by a demanding 7-year residency program. The educational commitment is among the longest and most intensive in all of medicine, cultivating exceptional surgical skill and clinical judgment. Beyond technical proficiency, neurosurgery demands an extraordinary ability to handle high-pressure situations. Surgeons must make critical, split-second decisions during life-threatening procedures. The margin for error is virtually non-existent, given the profound impact on patient neurological function and survival. The economic principle of supply and demand significantly influences neurosurgical compensation. There's a consistently high demand for neurosurgical services due to the prevalence of neurological conditions and traumatic injuries. However, the supply of qualified neurosurgeons remains limited due to the extreme difficulty and length of training. This imbalance naturally drives up compensation. Furthermore, the inherent risks associated with neurosurgical procedures contribute to their high value. The potential for severe patient outcomes necessitates a high level of responsibility and expertise. This risk factor is reflected in the professional fees and overall compensation structure for neurosurgeons. The continuous advancements in neurosurgical techniques and technology also play a role. Neurosurgeons must constantly update their skills to incorporate innovations like minimally invasive approaches and advanced imaging. This ongoing commitment to learning and adaptation further justifies their premium earning potential. Orthopedic surgery specializes in the diagnosis, treatment, and prevention of disorders of the musculoskeletal system. This includes bones, joints, ligaments, tendons, and muscles. Orthopedic surgeons address a wide spectrum of conditions, from sports injuries to degenerative diseases. The high earning potential for orthopedic surgeons stems significantly from the prevalence of musculoskeletal issues across all age groups. Conditions like arthritis, fractures, and back pain are widespread. This ensures a consistent and substantial patient volume requiring specialized care. A major driver of demand and subsequent compensation is the increasing need for joint replacement procedures. As populations age, the incidence of debilitating conditions like osteoarthritis rises. This leads to a growing number of patients seeking hip, knee, and shoulder replacements to restore mobility and quality of life. Similarly, the rising popularity of sports and active lifestyles contributes to a high demand for sports medicine procedures. Orthopedic surgeons are crucial in treating athletic injuries, performing complex ligament repairs, and managing overuse syndromes. This niche market further enhances their earning capacity. The complexity of surgical interventions in orthopedics also contributes to their high earnings. Procedures can range from intricate spinal fusions to complex fracture repairs and limb reconstructions. These operations require significant surgical skill, specialized equipment, and extensive post-operative management. An aging global population ensures a steady and increasing stream of patients requiring orthopedic care. Degenerative conditions of the joints and spine become more common with age. This demographic shift guarantees a sustained demand for orthopedic services well into the future. Moreover, an active lifestyle across all age demographics, including younger individuals, leads to a higher incidence of musculoskeletal injuries. This broadens the patient base beyond the elderly. It encompasses athletes, active professionals, and individuals seeking to maintain physical function. The development of advanced surgical techniques, such as arthroscopy and robotic-assisted surgery, has also elevated the value of orthopedic expertise. Surgeons proficient in these minimally invasive methods offer patients faster recovery times and improved outcomes. This specialized skill set commands higher compensation. Orthopedic surgeons often manage chronic conditions that require long-term patient relationships and follow-up care. This continuity of care, combined with the significant impact on a patient's mobility and independence, underscores the value of their services. This value is reflected in their compensation. Plastic surgery is a highly diverse specialty that encompasses both reconstructive and cosmetic procedures. While often associated with aesthetic enhancements, a substantial portion of plastic surgery involves restoring form and function following trauma, disease, or congenital defects. A significant contributor to the high salaries in plastic surgery is the robust and growing demand for cosmetic procedures. This segment of the practice is driven by evolving societal trends, increased disposable income, and a greater emphasis on personal appearance. Patients seek procedures ranging from facelifts and breast augmentations to liposuction and rhinoplasty. The demand for cosmetic procedures is heavily influenced by advancements in surgical techniques and non-invasive technologies. Innovations like injectables, laser treatments, and refined surgical methods offer safer and more effective results. This makes cosmetic enhancements more accessible and appealing to a broader demographic. Beyond aesthetics, reconstructive surgery plays an equally crucial role in the specialty's strong financial standing. Plastic surgeons perform vital procedures for patients with congenital defects like cleft palates, those recovering from severe trauma such as burns, and individuals undergoing cancer reconstruction, particularly after mastectomy. The ability to restore both function and appearance after disfiguring conditions is immensely valuable. This aspect of plastic surgery significantly improves patients' quality of life and psychological well-being. The complexity and transformative impact of these procedures justify substantial compensation. Plastic surgeons often operate in both hospital settings for reconstructive cases and private clinics for cosmetic procedures. This dual practice model allows for diversified revenue streams. It also provides greater autonomy and control over their professional environment and earning potential. The highly specialized skills required for intricate tissue manipulation, wound healing, and aesthetic judgment are unique to plastic surgery. Mastering these techniques demands extensive training and an artistic eye. This combination of medical science and artistry is highly valued. The global rise of medical tourism for cosmetic procedures further boosts the demand for skilled plastic surgeons. Patients from various countries travel to seek high-quality, often more affordable, aesthetic treatments. This expands the market for plastic surgery services. The direct patient pay model, prevalent in many cosmetic practices, also contributes to higher earnings. Unlike insurance-based models, this allows surgeons to set their fees directly. This provides greater financial flexibility and potentially higher profit margins. Cardiology focuses on the diagnosis, treatment, and prevention of diseases of the heart and blood vessels. This critical specialty addresses a wide range of conditions, from coronary artery disease and heart failure to arrhythmias and valvular disorders. The high demand for cardiologists is primarily due to cardiovascular disease being the leading global cause of morbidity and mortality. Heart conditions affect millions worldwide, necessitating continuous and specialized medical intervention. This pervasive health challenge ensures a constant need for expert cardiac care. Within cardiology, interventional cardiology is particularly lucrative. This subspecialty focuses on catheter-based procedures to treat structural heart diseases. These minimally invasive techniques offer significant advantages over traditional open heart surgery, including faster recovery times. Interventional procedures such as angioplasty and stenting are highly specialized and technologically intensive. They require advanced training, precision, and the use of sophisticated imaging equipment. The complexity and life-saving nature of these interventions command premium compensation. The continuous innovation in cardiac devices and pharmacological treatments also contributes to the value of cardiologists. They are at the forefront of implementing new technologies like pacemakers, defibrillators, and novel drug therapies. This expertise in cutting-edge treatments is highly sought after. Cardiologists often manage chronic conditions that require long-term patient follow-up and complex medication regimens. This ongoing care, combined with the critical nature of heart health, establishes a strong and continuous patient-physician relationship. This contributes to sustained practice revenue. The aging population further exacerbates the demand for cardiac services. As individuals live longer, the incidence of age-related cardiovascular diseases increases significantly. This demographic trend ensures a growing patient base for cardiologists for decades to come. The ability to perform life-saving procedures in emergency settings, such as during a heart attack, underscores the critical role of interventional cardiologists. Their immediate availability and expertise can dramatically alter patient outcomes, making their services invaluable. The integration of advanced diagnostic tools, including echocardiography, cardiac MRI, and electrophysiology studies, also adds to the complexity and value of cardiology. Cardiologists must interpret intricate data to formulate precise diagnoses and treatment plans. Urology is a surgical specialty that focuses on the urinary tract systems of both males and females, and the male reproductive system. Urologists treat a wide range of conditions affecting the kidneys, bladder, prostate, and male genitalia. The high earning potential in urology is significantly fueled by the increasing incidence of several common conditions. These include prostate cancer, kidney stones, benign prostatic hyperplasia, and urinary incontinence. These conditions affect a large segment of the population, particularly as they age. Prostate cancer, in particular, is one of the most common cancers among men globally. Urologists are central to its diagnosis, staging, and treatment, including surgical removal and other therapies. The prevalence and serious nature of this disease ensure a consistent demand for urological expertise. Kidney stones are another highly prevalent and often recurrent condition that drives patient volume. Urologists perform various procedures to remove stones and prevent their recurrence. This includes minimally invasive techniques that have revolutionized treatment. The adoption of minimally invasive surgical techniques has greatly contributed to urologists' financial success. Procedures like laparoscopic and robotic-assisted prostatectomy, ureteroscopy, and percutaneous nephrolithotomy offer patients less pain, shorter hospital stays, and quicker recovery. These advanced techniques require specialized training and sophisticated equipment, making urologists proficient in them highly valued. The efficiency and improved patient outcomes associated with these methods allow urologists to manage a higher volume of complex cases. Technological advancements in diagnostics and treatment also play a crucial role. Innovations in imaging, laser therapy for stones, and new pharmacological agents for bladder conditions enhance the effectiveness of urological care. Urologists must stay abreast of these developments. The aging demographic also significantly impacts the demand for urological services. Conditions such as benign prostatic hyperplasia and urinary incontinence become more common with age. This ensures a steady and growing patient population, requiring specialized urological management. Urologists often manage chronic conditions that require ongoing monitoring and treatment. This long-term patient care model contributes to stable practice revenues. The impact of urological conditions on quality of life makes effective treatment highly valued by patients. The ability to perform both medical management and surgical interventions provides urologists with a broad scope of practice. This versatility allows them to offer comprehensive care, from initial diagnosis to complex surgical solutions, further enhancing their professional value. The top-earning medical specialties share several defining characteristics that underpin their substantial compensation. A primary commonality is their involvement in highly complex procedures. These interventions often target vital organ systems or intricate anatomical structures, demanding exceptional precision and expertise. These specialties invariably require extensive and rigorous training pathways. The years of medical school, followed by demanding residencies and often fellowships, cultivate a depth of knowledge and skill that is rare and highly specialized. This prolonged educational investment is a significant barrier to entry, limiting the supply of qualified practitioners. Furthermore, these fields address conditions with high prevalence and significant patient impact. Whether it's life-threatening neurological disorders, debilitating musculoskeletal issues, or widespread cardiovascular diseases, the conditions treated by these specialists profoundly affect patients' quality of life and longevity. This critical impact elevates the value of their services. The substantial financial rewards in these specialties are a direct result of a confluence of factors. These include the highly specialized skills required, the consistently high demand for their services, and the inherent risks associated with their complex procedures. The combination of scarcity, necessity, and responsibility drives their premium compensation. While financial considerations are a valid and important aspect of career planning, it is crucial to remember the broader purpose of medicine. A truly successful medical career is ultimately built upon a foundation of compassion, unwavering dedication, and an unyielding commitment to patient well-being. These intrinsic values remain paramount, regardless of earning potential. The pursuit of excellence in any medical field, coupled with a genuine desire to serve, defines a fulfilling professional life. Understanding the economic landscape provides valuable context, but the core mission of healing and care remains the guiding principle for all healthcare professionals.